Hello and welcome to this WION Digital Summit. I hope you're all safe and doing well. The Wuhan virus pandemic has restricted in-person meetings, but restrictions do not mean an end of conversation. At WION, we believe nothing should dampen the spirit of conversation and nothing should be left out from these conversations. So we have put together this one-of-a-kind summit for you to address one of the most relevant issues of our times, mental health. At least 970 million people worldwide are suffering from mental health problems. 970 million. That's more than the entire population of Europe. And this number is 4 years old. Today, there is no estimate on how many people are silently suffering from anxiety, stress, or depression. The pandemic has added to these problems. It has made us lonelier, limited our interaction with the world, clipped our networks, and made it harder for us to access mental health care. While a lot has been spoken about and written, when it comes to the effects of this pandemic on jobs, economy, or our physical well-being, very little has been said on what the Wuhan virus pandemic has done to our mental well-being. The problem of mental health has been largely ignored by all stakeholders, and that's why we are calling mental health a silent pandemic. Today, through this summit, we aim to bring mental health to the talking table. With the help of all of you, our global audience, we will strive to destigmatize mental health. Over the next couple of hours, we'll make a sincere attempt to answer all the frequently asked questions. By the end of this summit, we hope to normalize conversations around mental health at homes, at schools, at offices, and in social circles. Joining me today are some of the most respected voices from around the world. Each of our panels today have been tailored to address issues that everyone watching this summit has faced, sometime or the other, in the year gone by. So without any further delay, let's get started with the first panel of the day, Lonely in the Lockdown.
Lockdowns have changed our lives. Lockdowns have limited our social interaction. While some countries are reopening, some others are locking down again. This is the new normal, one in which we are confined to our homes, where we work, study, and socialize from home. Many of us are lonely at home. How is the world coping with this loneliness of the lockdowns? Session 1, Lonely in the Lockdown. Our dialogue partners for this session are Michelle A. Silva, Director of CT Latino Behavioral Health System and Assistant Professor at Yale University School of Medical Science. Stephen Taylor, Professor and Clinical Psychologist at the University of British Columbia. Jacob Teebs, Professor of Psychiatry at Yale University and Director of the Yale Division of Prevention and Community Research and the Consultation Center. Michael Eriksson Benros, Head of Research, Biological and Precision Psychiatry, Copenhagen Research Center for Mental Health, and Professor of Immunopsychiatry, the University of Copenhagen.
Michelle, gentlemen, thank you for joining us on the first session of this virtual summit.
Thank you for having me.
Thanks very much.
Sure. Let me start with Stephen Taylor. You have researched and written at great length on the psychology of a pandemic. The Wuhan virus pandemic is the worst that we've seen in a generation. We've never lived through such lockdowns and restrictions in the past. Numbers on mental health problems from around the world have gone off the charts. What, according to you, was the biggest contributor to this mental health crisis during lockdowns? Was it loneliness?
No, there are a number of things that contributed to people's mental health distress. One is pre-existing psychological problems. Another is traumatic experiences that happened during the pandemic. And a third that affected many people is lockdown. Lockdown turns out to be very bad for people's mental health. Lockdown is a necessary evil for containing the spread of infection, but it is bad for people's mental health.
Right. Michelle Selva, more than 42% of people surveyed in the US by our country's Census Bureau in December reported symptoms of anxiety or depression. When was the last time you saw figures like these, and what, according to you, contributed to this rising graph?
figures are staggering. And I think it's important to recognize that in periods where there is unpredictability, where the loss of a sense of safety, emotional, psychological, physical, instances like these where we have uncertainty are moments where we see these increased numbers of psychological distress. And so the loss of that certainty on a day-to-day basis and routine really contributed to that rise in mental health difficulties for both adults and children.
Michael Benrose, a lot of your work is in the field of immunopsychiatry, and I'm sure you've come across patients who are stressed about the virus, they fear the virus or the fear of a weakened immune system. I'm going to ask you to help our viewers understand how big a role can the immune system itself play when it comes to contributing to mental health problems, especially during a lockdown?
Yeah, I think the immune system's role is particularly in the ones infected with the virus, where both the peripheral inflammation can actually affect the brain. And also in some cases, very, very rare, the virus can get into the liquid surrounding the brain. And it can also cause a post-infectious autoimmune condition where the immune system actually attacks the brain, but that is also rare. But I mean, this direct effects of the infections can affect the brain and thus also the mental health of the patients. And you actually see in the acute phase of infection in people that are hospitalized, it's around 40% that have delirium, which is a very diverse onset of mental health symptoms. And in the long pattern, they have increased risk of depression and anxiety particularly.
Michelle Silva, lockdowns have also forced women especially into playing multiple roles. They've been doing office work, taking care of the elderly and kids at home, helping with children learning online, and a whole lot of other things. The list is never ending. How is this affecting an average woman's mental health?
Thank you for that question, because absolutely, the mental health of women, as I've seen clinically, has been very much compromised by the various roles and strains that this pandemic has posed for them. As you mentioned, schooling, taking on the responsibility of not just household responsibilities in some cases, but balancing work, home, and children's schooling as well, taking care of family members who are ill. And so what we have seen is a rise in anxiety symptoms, depressive symptoms, and a real need for some self-compassion and sharing with women the need to take things day by day and have some compassion with themselves as they try to manage the uncertainty of these times.
Let's also talk about the aftermath of a lockdown. Different countries are going through phases of these. Stephen Taylor, allow me to quote you here. You've said that for a generation shaped by the coronavirus, life may never fully return to normal. Why do you say this?
It's mainly because a significant proportion of people are likely to develop long-term psychological problems. It's difficult to estimate the percentage. Numbers I've seen, around 20% of people could develop serious chronic conditions such as post-traumatic stress disorder, chronic grief disorder, and so forth. And for those sorts of individuals, life may never be the same, and they will need psychological treatment. Other people, well, most people in communities do tend to bounce back, but it's that significant minority of people that will need psychological assistance.
Michael Erickson, do you want to come in here? Do you see a lot of people developing lasting anxiety because of lockdowns and confinement? And how do you see this playing out in the long term?
Yeah, I think the long-term effects is still a question mark since we have had such a short time available. But there seems to be a difference between the direct effect and the indirect effect, whereas the indirect effects on the community, there seems to be an overall decrease in mental health being. But so far, if you compare to before the pandemic, it has not been so excessive as we have originally thought. But of course, much can still happen, and it depends on how long the pandemic will continue, and also if it ends into an economic crisis, which would then again worsen the mental health of the individuals in the society, as we saw after the financial crisis, for instance.
Michelle Silva, do you see people developing obsessive-compulsive disorder like germ phobia or the fear of interacting or shaking hands with people? And how likely is this to last even when the pandemic is over, when it's over?
So it's an interesting question, because for some people who may be more vulnerable to those types of thoughts and behaviors, there has been an increase for sure, as the fear of health-related concerns have increased. It's unclear if some of that would translate longer term. However, there is also some very real concerns that are valid, that all people, in these situations have right now, with their rational fears, concerns. And so really making sure that people are informed of the public health precautions in a way that they can still try to engage in their day-to-day becomes really important at this time.
While mental health problems are being underreported during the pandemic, what's being ignored the most, perhaps, is the effect of repeated lockdowns and ban on gathering on children. Most of them are too young to understand what really is happening, but they're all being told to not go out and play, to not meet friends. Jacob Teebs, you're associated with the Child Studies Center. Please tell us how lockdowns have affected children and what symptoms are they now showing?
Well, children and families have a number of challenges during the lockdown. I think one of the things that we've heard through working with healthcare workers in the Yale New Haven health system, their family members, and other adults throughout the tri-state region through these interactive town halls, virtual town halls we've done, is the real challenges that both parents and children have during this pandemic, keeping up with schooling, sharing space at home, the concerns about sending the children to school or not, given the pandemic. So that's been very stressful for children and for parents throughout this entire pandemic. It's one of the leading stressors of the several that we consistently see reported by parents and children.
Stephen Taylor, do you want to weigh in on this? How have lockdowns impacted children?
It very much depends on their developmental level and their living circumstances. If you get children who live at either the extreme of isolation, such as a single child family, or extremes of overcrowding, both of those can be highly stressful for children. For some children, it may be that their fears are not so much fear of getting infected, it's more of a fear of performing well in school. Some children have developed significant separation anxiety, so they've been together with their parents for so long. Now lockdowns are being lifted, it's becoming an issue for them to go out and go to school and play with friends, because they are becoming anxious about being separated from their families. Hopefully those sorts of problems won't be long lasting, and kids will adapt and bounce back to where they were before.
Right. Michael Benrose, how does it impact working professionals? The work-life balance was a problem that most people dealt with even before a lockdown. In a lockdown, when you work from home, there is practically no line that divides your personal life from your professional life, because you're always on a call or something. How do you think it impacts? What kind of pressure does it put on people?
Yeah, I think, again, you could say the impact has been very different also depending on your living circumstances, where some people have actually felt a relief of being away from the work and having more time at home, whereas others has felt this very stressful. So actually, we have seen a larger variation within people that we usually see in non-pandemic periods. So I think it varies very much, and you can say referrals to stress clinics, for instance, in Denmark, has decreased a lot during the pandemic. So it seems to be other symptoms that are then not work-related, that are related to your personal life and not seeing your friends and being worried about getting the disease. So the problem seems to have shifted a bit, at least in the working market. And of course, in addition to that, you can also say the healthcare professionals that have taken care of the patients with the COVID-19 were affected by this with increased levels of depression and anxiety, particularly in the initial phases, whereas here later in the pandemic, you see a more lessened response in these healthcare professionals in the front line.
Right, and while we discuss the problem, we are also here to try and find solutions to these problems. And we do have vaccines for the Wuhan virus, but we don't really have a full-fledged plan in place for battling what we're calling this a silent pandemic, the mental health problem that many people are now facing. Stephen Taylor, these cycles of repeated lockdowns may not come to an end anytime soon. How do you suggest we cope better with them? How do we stay mentally healthy through the pandemic in general and during a lockdown in particular?
Coping with lockdown requires interventions from all levels of society. So things that individuals can do, things communities can do, and things that our health authorities can do. It's important for health authorities to make lockdowns predictable and controllable. So if I know I'm going in for a lockdown for, say, 2 weeks, it's going to be easier for me to cope with than if lockdown is indefinite. So you can do that. Another intervention, of course, is stress management, basic stress management skills that people have been using or perhaps have slackened off over the past 12 months. It's getting back to things like setting a regular routine, getting plenty of exercise, a healthy diet, getting plenty of sleep. So those sorts of things can help. If they're not sufficient for coping with lockdown distress, then there are a number of phone apps and internet websites that can offer advice such as cognitive behavioural tips and strategies for coping with stress and anxiety and depression.
Michelle Silva, what is your advice to our viewers and to those who are watching us right now? How do you think they should deal with mental health problems at home, and how do they stay mentally healthy while being locked down?
One of the primary tips would be to be patient with themselves. This is a situation that is unprecedented in many ways, that we are all facing that uncertainty. All family members in many ways are experiencing the stress at different levels. And so to be aware of what's going on, but also to be patient with the process and try to maintain choice and control where possible, try to reassure one another where possible. And to gradually re-enter, this new normal that we will all be facing. In terms of being alert, paying attention. If there are some changes that seem a little bit more excessive than others, we always think clinically about frequency, duration, and intensity of different signs and symptoms. So paying attention to those as well when needed. But really to be patient with oneself, and as was mentioned by a panelist earlier, to identify those strategies that are helpful.
Jacob Teebs, you consult to public agencies. How would you suggest governments around the world deal with mental health problems better? They're so overwhelmed right now. Systems are so overwhelmed. They're not even looking at this aspect of the pandemic.
Well, you make a very important point about the importance for broader systems, governments, other broader systems that impact people's lives to really take an active stance in promoting mental health. We think institutional responses, either at the community level, at a work site level, at schools, really need to be implemented. That's one of the things that we've learned in working with thousands of healthcare workers in our tri-state region, is the importance of creating a tiered support model so that there's opportunities for individual professional health in connection to that, peer support, support to leaders in those settings, as well as support for individuals in the broader community. That can be done, and it can be very effective. We have found that people have had a number of very successful strategies in supporting each other mutually, and also using what we know from research, our evidence-based practice to promote resilience. I can tell you the two biggest ones that we've seen reported are cognitive strategies to deal with it, to promote mental health, as well as behavioral ones. The cognitive ones we've seen have to do with practicing acceptance of yourself, others, and the situation, only doing what you think you can do right now rather than what you want, and then using positive reappraisal, finding something positive in the situation, using lessons learned, maybe reflecting on what you're grateful for. And behaviorally, we have found three strategies especially helpful: building social connections through families, friends, co-workers, practicing self-care, exercise, eating right, routines, meditation and mindfulness, and finally engaging in things that are valuable to you, such as things that give you joy or things that are meaningful. All of those things, especially if supported by our broader institutions, can have a big impact on the mental health of the population.
That's a big if. Do you think society in general and governments in particular are even looking at this issue at the moment?
I think they're being forced to in many ways because the mental health needs that come through are so significant. Only a year and a half ago, the base rate of anxiety and depressive disorder symptoms in the U.S. CDC Pulse survey was about 11%, maybe 11 to 15% at one time. It then tripled, more than tripled, a year later when the pandemic happened. And so it's been hovering around 40% for the general population now. So government, institutions, they're going to need to be responsive to this because when you have more than a third of individuals with significant symptoms of anxiety or depression, you need to do something about it. It has a significant effect on the broader economy and other kinds of well-being and lifestyle of people living in the population.
Michael Erickson, every day we report on some country in the world, some places in the world, reimposing a lockdown, reimposing restrictions. How can people prepare themselves for these situations? How can you sort of condition yourself to the fact that this is the new normal? There'll be times when you can go out of the house and go out and about, and then there'll be times when you will be confined to your homes, and that should be acceptable.
Yeah, it's very difficult and challenging. I think one way, at least for the work, is to have a home office for the ones where this is possible, to have a distinction between working and being free time off, and also to remember during periods of lockdowns to actually keeping up your normal routines with exercise, as we have heard of before, remaining contacts with family and friends, and going over to digital contacts instead when the physical is not possible. And of course, people have to remember to reach out to healthcare professionals if they're in need of more care or if they have affected mental health, since the healthcare system during lockdown is still open. So if people have new onset mental health issues, they should contact their doctor right away to get the sufficient help and support needed.
Michelle Silva, do you believe enough people realize that being in a lockdown affects them psychologically and mentally, and that's something that they need to address at a personal level too?
I think increasingly people are realizing that this is something that has changed life as people may have been used to going through it and living. And so there is more attention now to how one is feeling and to those disruptions that have occurred. The hope is that as some of this does receive more attention, people also are more willing to seek out professional help when necessary, and that some of this can also address the stigma of seeking mental health care and knowing that it's okay to do so, particularly in times of extreme stress as we're all facing now.
Stephen Taylor, in the past 1 year, we've seen some behavior that is hard to explain, at least for us lay persons. Like when the UK lifts a lockdown, you see people going to pubs at 5 a.m. In India, we're talking about something called revenge tourism, revenge travel, because people have been locked down or isolated and prohibited from travel. There's a sudden rush. Is this also an impact of a lockdown, and is this a way for people to find some sort of a release after being restricted for so long?
Yes, human beings are naturally social creatures, and so lockdown requires us to not socialise in a way that we'd sooner do so. And so, yes, after lockdowns are eased, you always see increases in sociability. In the 1918 pandemic, we saw the Roaring Twenties. Here we're seeing smaller episodes of hyper-sociability when people get released from lockdown. So this is an entirely normal and expectable reaction.
Right. Jacob Teebs, let me ask you the final question of this session. How can individuals, you and I, and everyone watching this summit, contribute to mental wellness?
Well, one of the things that's been a little underestimated but highly appreciated is the power of kindness. We are all not at our best right now. This has been a difficult time, and it's been difficult because it's been so prolonged, and it's happening to most everybody, not just a few individuals in our sphere. Kindness has gone a long way, and we've heard that when someone is not doing so well and then is the recipient of some kindness, it makes a big impact on them. It really enhances their well-being. So if you have the opportunity to accept someone's kindness, please do so. And if the opportunity to reach out and be kind to others, that'll go a long way during this time.
I think that's a wonderful note to wrap this session on. Thank you very much. It's a wrap on the first session, Lonely in the Lockdown. We hope that those watching us were able to take notes from the wonderful panelists and whatever they had to say today. Thank you all for joining us on this digital summit, and stay safe. That was our first panel. One thing's for sure, this pandemic has thrown away every sense of balance from our lives. It has jeopardized our education plans, our career plans, personal plans. Coping with this new normal of uncertainty can be really difficult. If you're struggling, please understand that you're not alone. And there is nothing wrong in reaching out for help. Talk to your family, talk to your friends, talk to certified experts, but do not ignore your mental well-being. Our next session focuses on the silent sufferers of this pandemic, the students.
This pandemic has been a student's toughest test. The Wuhan virus has disrupted learning, interfered with a student's development and growth. This virus has snatched away some of the most memorable years from a student's life, even denied a graduation. As classrooms gather dust, our students are locked up at homes, away from their friends, teachers, and every sense of normalcy. What toll has the pandemic taken on students? Let's find out. Our dialogue partners for this session are Christophe U. Correll, Professor and Chair of the Department of Child and Adolescent Psychiatry at Charité University Medicine in Berlin. Regan A. R. Gurung, Associate Vice Provost and Executive Director for the Center for Teaching and Learning. Christine Bianchi, Clinical Psychologist at the Center for Anxiety and Behavioral Change. Debbie Sorensen, Clinical Psychologist.
Ladies and gentlemen, welcome to WION's Digital Summit. We are talking about how the pandemic has affected students. The biggest switch in the education sector during this pandemic was the shift to online learning. This was, we know, out of necessity, not choice. Debbie Sorensen, how stressful was it for students to cope with this new form of learning?
You know, it depends. I think that kids can be very adaptable, and some kids were able to make the best of it and do okay. But for many children, I think they were isolated. They may have struggled. It might have been hard to motivate because they didn't have their teacher in person, their fellow students in person. And for many, it was just much harder. So I think it could be stressful for a lot of children and teenagers and students.
In fact, online learning has also been meant very little social interaction. And this has been one of the major stresses for students. Christine Bianchi, what goes on in a child's mind when she has to be kept away from her peers for a prolonged period?
Well, as social creatures, children get lonely. And so for some of them, we see a lot of confusion around, this new social script and how to interact in that virtual world.
And these children who got online learning were, in a way, the best off because Dr. Christophe Correll, not every student could avail or afford online learning in these past 1.5 years. What happens to a young student's mental health when she's forced to drop out of school?
That's obviously a catastrophe for many patients and people who are in that situation, both from a personal perspective, identity, self-efficiency and development standpoint, but also economically. And even those that are affording online learning but can't have the structure, as one of the other panelists said, might fall back and not fulfill their full potential. And obviously, especially in countries with low resources, where not every family has sufficient online access or computers available, especially those that are already on the lower socioeconomic end are those that suffer the most and are at risk of changing lives for the worse. In our COVID study, www.cohfit.com, we're looking at international movements, and unfortunately in India only 750 people have participated out of 152,000 around the world in 155 countries. So we need to learn more who is left behind, who can actually resolve some of the issues of the pandemic and be a student or a parent to basically navigate the pandemic best.
Right, not going to school and not meeting your friends and teachers is problematic. Having to drop out of school is worse. And this is a worst case scenario, some would say. In a lot of cases, schools also ensure the day's meal for students. In India, for example, we have the midday meal program where government schools provide free lunch to students. And this acts as an incentive to go to school. It also fights malnutrition. The lockdown has forced many students to go hungry. Regan A.R. Gurung, how, according to you, has this affected a child? Because in a way, for a child in this condition, in this situation, this pandemic has completely turned her life upside down.
Yeah, so I think a couple of key things to keep in mind is that depending on how, we've been talking about children in general, and I think we've got to be really sensitive to the fact that some of these effects can be even worse for younger children versus than others. I do a lot of my teaching in college. College-age students are a very different breed than younger children. Especially, I think something that we don't talk about enough is the role of nutrition and sleep and physical activity and in mental health. And very often, if you are not getting those basics, if you are not getting enough food, if you are not getting the exercise, if you are not getting enough sleep, your learning can completely suffer. Even here in America, just like you mentioned in India, many schools, children get their food from school. They get their breakfast. The first thing in the morning, they get their breakfast from school. And if that is changing, if there is uncertainty in where they're getting the food, that can have a very direct effect on learning, on attention, on concentration, on a whole range of factors.
Debbie Sorensen, let's talk about college students. And data from American Psychological Association shows that the pandemic has been the most stressful for those aged 18 to 23. What do you think explains this?
Even prior to the pandemic, at least here in the US, many people in that college age bracket were already struggling with mental health issues. And I think it's such a time when there's so much happening with learning and development and socialization that I think for a student that age many were in their room doing their work alone. They were not able to engage socially in the way that you would normally expect at that age. And just as panelists have been saying, I think the social component, being active, it's really crucial. And so, yes, I think many have experienced a high level of anxiety and depression.
Dr. Christoph Korrel, do you think students, especially overachievers, will start questioning their self-worth because of lost opportunities during the pandemic? And how is all of this expected to affect them mentally?
Yeah, I mean, I think people will question themselves, but I'm not sure it's particularly overachievers. It's everybody who can't achieve their full potential. But we have to realize that there are winners and losers, as always, and those that have will be given because they are in a better situation. They can maybe go home, especially those college students that suffer the most are alone now. The younger kids have still the buffer of parents, but the buffer of parents might also wear thin if they are under a lot of COVID-related stress, be it psychologically or also economically. I don't think we'll have like a generation COVID, but we will have people who are questioning their identity because when they're in their adolescence, they are defining themselves more and more via social interactions and their peer group. And that's somewhat taken away at the moment. But they will catch up the moment there is the opportunity. But not everybody will. There are some people who will fall through the grid. And we need to know who they are, identify them early, and also offer low threshold access points for them to access help, be it via the internet, self-help, but also professional help psychiatrically and psychologically.
Dr. Kristen Bianchi, why is it that studies show that women and students of color have been disproportionately affected by high levels of stress and pressure during the pandemic?
In the case of women, what we are seeing, at least here in the U.S., particularly those who work full time, so they're functioning in their jobs, they're functioning as moms, they're functioning as teachers, disciplinarians, etc. And so the multiplicity of these demands is really exhausting, and inconsistent structure in the home if parents are working and not present, and thus these children aren't receiving their full education. They're not able to see their friends, and they're also missing structure in the home, and so that has really been particularly detrimental. And yes.
Dr. Gurung, in a lot of countries, authorities are focusing on what they're calling this new normal, living with the virus. But what are the long-term effects of this pandemic, according to you, on the mental health of young students?
Right. I think I want to highlight two key things that have been discussed that are really important in this context. One is that the good news is we are resilient. Students are resilient. Children are resilient. They will bounce back. They will bounce back given the right support and the right environment. That said, I think the big issue is when we think about long-term consequences, I think the onus is on all of us for what sort of support can we give students? What sort of openings can we make for students? I think Dr. Sorensen mentioned that mental health was always an issue. I mean, you look at studies from even 10 years ago, 30, 40, and 40% of students are reporting anxiety and depression. A recent study right out of Mumbai just last year showed that 50% of students in India were showing depression and anxiety. Now, it's up to us to give students the opportunity to talk about that. And here's the big one, and especially when you talk about students who are maybe minorities or of color or from certain ethnic groups, you have to make talking about mental health okay. It's got to be okay to talk about it. I think many of our students will have these mental health issues because of the pandemic, because of the stressors, because of learning at home. We have to make it easy for them to talk about it. We've got to make it okay for them to talk about it. And I think then we can cut down on the long-term consequences. If we just push it under the rug, if we do what many countries have done for a long time, which is, oh, it's not okay to talk about it. What will people say if I talk about my feelings? We're not going to help our students. That's something we've got to really focus on.
Indeed, and that's the effort here when we're holding this summit. The problem is that not many people are talking about any of this, and we're calling mental health a silent pandemic. Dr. Correll, do you think lockdowns have also affected a child's relationship with her parents? Are isolation and mental health issues taking a toll on this bond too?
Well, lockdowns have been effective in reducing the transmission, obviously, of the virus, and they can have downstream effects. They can have, in some cases, where the system was resourceful, be positive. Spending more time with the kid, not being away as a parent and commuting can be helpful. But if the parents basically needed to be apart from each other to make the system work and now they're fighting, that can be a problem. If there are problems with coping strategies in the parents, like maybe funneling the aggression toward the spouse or even the kid, using substances, all of this can be very detrimental to the kids. And then even within a system that is not toxic or becoming toxic because of the stressor of the pandemic, not having the buffer, going outside, having friends and families, a teacher, a sports trainer that provides extra input into the social and also individual development of the kid, that can take a toll, absolutely. And we hope that this can somehow be basically helped or equilibrated by resources that they have internet-wise or other friends. We looked at coping strategies in the COFIT study, www.cofit.com, and the 4 major coping strategies for adults, but also for children and for adolescents were the internet. Second were social media, but also exercise, walking and moving around, and then doing something meaningful with their time, be it even a hobby. But social contact, personal contact, was the 5th one. So if you can allow for that, despite the pandemic, with selected people who are helpful, that can also be quite positive in the coping, even when there is a lockdown.
Right. Let's talk about kindergarten students. Dr. Debbie Sorensen, this is for you. What happens when all of a sudden, one day kids are told that they won't be going to schools or meeting their friends anymore, they won't even be going to the playground, and this is the age when children are just beginning to explore the world outside home?
Well, it's funny you mention it, because I have a daughter who just finished kindergarten this past year, and I think that it is very, there's a lot of change happening fast, and I think that it's really important, as has already been said, to talk to them about their feelings, to give them support with how hard that is, because, they're smarter than they sometimes might seem at that age, where they're able to, if you can talk to them about it and to help them understand, I know this is hard for me too, and it's okay to feel worried, to miss your friends, and again, to do your best to provide their basic needs, safety, lots and lots of love and support really helps them make it through that period, because I think it's hard for them to understand, but they might be able to understand more than we realize.
I think we all agree that children across age groups have been affected. Dr. Kristen Bianchi, what kind of symptoms should we as parents be looking out for, especially parents of adolescents and teenagers, if I may?
Certainly, that's a wonderful question. First and foremost, we want to be looking at loss of interest or pleasure in activities that were previously enjoyed. When we see people losing their drive, children especially, and motivation, that may be a symptom of depression. Changes in sleep, so whether that's difficulty sleeping or sleeping too much, changes in appetite and or weight fluctuation. But we may also look at irritability, a shorter fuse, more quickness to anger, tearfulness, and to some extent more in the way of vocalization of worry and anxiety. So those would be the primary cluster of symptoms that I would recommend that parents be on the lookout for.
Right. Let's also talk about solutions. How can we help students overcome stress and anxiety? Dr. Debbie Sorensen, I want to quickly come back to you, since you've been training mental health professionals. Do you think that conventional counseling may be a little ineffective, especially for younger students? And I ask this because adolescents and teenagers, in most cases, tend to listen more to their friends than elders.
It depends. I mean, I think for some people who are really, really struggling, I think that having a mental health professional support can be really beneficial. I think that for many, like you said, having a caring adult in their life is the most important thing, and having social support so parents can fill that role, neighbors and friends and family members, teachers. And I think even with the lockdown and the pandemic, we may not have as many people as usual, but if we have one or two that we can talk to who support us, I think if it's just that kind of normal level of stress and anxiety, that this is really hard for so many of us, I think that having any type of support is beneficial. And then if it is really getting to be more worrisome, more serious, it's really a struggle to get out of that place. I think reaching out for professional support can be helpful as well.
Dr. Gurung, what do you suggest? How can we get children to talk their minds out, and how can we help them overcome stress?
I think there's a lot colleges and universities and schools can do. I think I'll give you one very practical example. Here at Oregon State University, every syllabus has what we call a reach out statement. It's in the syllabus. It basically says, look, college is tough, college is stressful, people do experience severe problems. Please, if you experience anything or if you don't feel good, here are numbers to call, here's what you can do. That is a very black and white, pragmatic way to make it easier for, I think, our students to reach out and get some help. And I think we've got to think about more of those very easy, in-your-face kind of ways that students know that it's okay to do it, and here's exactly how they can do it. Let's make it easier for them.
Dr. Corral, how can parents help, and how can they ensure that the pandemic is easier for students especially?
I think there are various ways. First, they need to look for their own mental health, because whatever is going on in the parents' minds and also between them that's problematic will filter down to the kids. So look after yourself, make sure that you're healthy, that you're moving around, that you're eating well, and that you're taking care of social relationships, either online or in person. And then the second is watch out for your kids and be communicative. We need communication. Ask them how they're doing. Make sure that you provide them with emotional and other support, that you're meeting their needs, and may ask a little bit more often in order to find out what's going on in their lives. Also provide structure, have routines and also some rituals that can be very helpful, and provide some certainty in this very uncertain period in our lives where everybody is struggling, not knowing when it will end. And look for coping strategies that work for your kid. Reinforce their strengths. Don't be as critical as you might usually or ordinarily be. Give them a little bit of slack, but also don't neglect them.
Dr. Christian Bianchi, what is your advice to governments? How can they help students? In India, we've seen a lot of debate over the holding of certain exams, and I assume it's very stressful for students because some are ready for it, some others are not, and you can't keep everyone happy, but it is a stressful period. What can governments do? What can administrators do to help students at a time like this?
I think that they can promote greater awareness around mental health, the importance of reaching out, for professional help if needed. They, as another panelist mentioned, they can make discussing mental health part and parcel of regular dialogue, such that it's coming down from the top to normalize mental health as part of overall health. And I think that when that can come from administrators, from the government, that really sets the tenor for how the public is going to interface with these topics. So that would be my strongest recommendation.
Dr. Gurung, we're talking about students, we've discussed parents, we've discussed the government, but what about the teachers? What is your message to the teachers who are watching this summit? How can they help reduce the stress that their students may be facing?
Yeah, I think you just heard some good advice lots of good advice about how let students be easy on themselves. I think teachers really, first off, need to take care of themselves to make sure that they're in the right state to take better care of the students. Over the last year, especially with the switch to remote teaching, a lot of teachers, educators are extremely overworked, extremely frayed and worn down. And I think that wear and tear has really accumulated. So yes, I would say first, please, teachers, take care of yourselves, get into a right mind frame, and then make sure, and here's the key, I think so often in college and schools and classes, we focus so much on the content and not enough on the individuals. And I think there's no better time than right now to take a holistic approach for teachers to also think about how is that student doing, not just how are they learning, not just are they getting this problem or are they getting this content, but how are they doing, and actually taking some time away from just getting content out there to give students an opportunity to talk about life and feelings and things like that. It's so easy to just focus on work and content and not leave space for discussions about feelings and mental health. I think it's important for all of us teachers, whether it's K through 12 or college, to build that safe space in our classes to let students really talk about the things that they're feeling and experiencing.
I think it's been a learning curve for teachers as well, especially technologically. I think students have adapted to this much faster than teachers who are still trying to figure out how online learning works. This is a question for Dr. Debbie Sorensen. Do you think that teachers, and this is a wide section of people I'm talking about across the world, but teachers generally are equipped to handle mental health issues of students while they are engaging in remote learning?
I think it depends. I think many are. I think more and more over time, teachers and educational systems are recognizing the importance of this. I think that it again, it's partially a resource issue, that I think there's a discrepancy there depending on, some teachers, it's tough. And I think teachers are doing their best to make it through. And I appreciate so much how hard teachers have had to work. And on top of that, I know that teachers are very worried about the well-being of their students. Most people go into teaching because they care. I think we're all doing our best here, and that what I've seen is that many teachers that I know are attuned to it. But again, I think that there's still work to be done. And I think that the more we have conversations like this and we promote the social and emotional part of education, the better for the students and for the parents and the teachers.
Yes, it's work in progress, I guess, for everyone. Ladies and gentlemen, thank you so much for joining us on this very special digital summit. Stay safe.
Thank you.
Thank you.
Thank you.
All the best.
It's not easy talking about sensitive issues like these on digital platforms, which I totally agree are a little impersonal. But the pandemic has left us with very little choice. The fear of contracting the virus has minimized interactions the world over and forced social distancing. What it has also done is stigmatize those who test positive for the Wuhan virus. The nature of the virus is such that patients need to be isolated, sometimes for 21 days at a stretch. And this can be really tough. And the ordeal does not end when the person gets a negative report. What we are seeing now is that many COVID patients are suffering from prolonged stress or anxiety even months after recovering from the virus. They're experiencing a kind of PTSD, or what's called post-traumatic stress disorder. To understand more about it, we have lined up a brilliant panel for you. So let's move on to the final session of this summit. We're calling it Post-COVID Panic.
It's a long road to recovery for Wuhan virus patients. Many complain of brain fog. Many report stress and anxiety. Some speak of prolonged tiredness, even loss of concentration. Is this post-traumatic stress disorder, or is it the new normal? How are you coping with the post-COVID stress? Session 3, Post-COVID Panic. Our dialogue partners for this session are Sharon Blady, former health minister of the province of Manitoba and founder Speak Up, Mental Health Advocates, Inc. Joshua C. Clappo, clinical psychologist and associate professor at the University of Alabama at Birmingham School of Public Health. Jeffrey A. Lieberman, Psychiatrist-in-Chief, Columbia University Medical Center of the New York Presbyterian Hospital. Allison Holdman, Associate Professor at the UC Irvine Sue and Bill Gross School of Public Nursing.
Dr. Holdman, I'm going to begin with you. You have researched extensively on post-traumatic stress. What kind of mental health issues do you see COVID patients facing when they're recovering from the virus?
Well, what we're seeing in the United States is that there was a growing, at the very beginning of the pandemic, there was a growing level of acute stress symptoms, which are post-traumatic stress symptoms in their early phase, and growing levels of depression. We've also seen that there have been increases in people becoming more worried and becoming emotionally exhausted over time as the pandemic waxed and waned. So at this point, with the vaccine rolling out and more Americans getting vaccinated, we're hoping we're going to be launching another wave of our study to understand how that's impacting mental health. My suspicion is that as people begin to get vaccinated and start normalizing their lives, there will be greater ability to feel more back to, quote, normal, as we say.
Right. Dr. Joshua Clappo, I recently read a study that says that 1 in 3 COVID patients have psychiatric issues even months after being infected. Is this problem so rampant, or is it worse?
No, well, I think one of the things you have to take into consideration is the level of infection, the degree to which they were ill. As we know, COVID patients can range from minimal symptoms to hospitalizations and intubation. So some of the symptoms or some of the psychiatric symptoms are really also a function of how distressing the illness was. I think the other thing is we have to think about the risk factors and the buffering factors. So while the numbers are high, individuals with pre-existing psychiatric problems, individuals in more difficult family situations, individuals who potentially were more isolated, they're going to be at greater risk. And as was commented before, as the vaccinations are coming through, as people are getting more healthy, as life is getting back to what used to feel like more normal, some of those symptoms and some of those conditions will subside, leaving fewer and fewer individuals in need of mental health treatment.
So we hope. Dr. Lieberman, what according to you leads to these mental health problems among COVID patients? I know that we tend to see other people with a bit of suspicion with the way this virus has spread. How big of a role does the taboo associated with the Wuhan virus play here? Or is it that 14-day isolation that is a bigger contributor?
Well, I think you have to make a distinction between the acute effects of the threat of infection or the experience of infection and the social and economic disruption that the pandemic is causing, which everyone feels to some extent. It's like when you go outside and it's in the winter and you ask someone, do you feel cold? They're going to say, yes, I feel cold. That doesn't mean that they're having a mental illness or that they're suffering from stress that's going to be enduring or damaging. So everyone is feeling a degree of stress, which they manifest some symptoms of trauma-like from. They may experience it to greater degrees, depending on how close they are to either having been ill or having people in their family that are ill or having their lives disrupted. But the thing that I worry about and I see as occurring in the aftermath, the months and the years after the virus is contained, is the vulnerable individuals developing syndromal mental disorders. And that's something which is going to evolve more gradually. It's not going to be an immediate effect.
Sharon Blady, a lot of people recovering from the Wuhan virus are reporting what's been called a brain fog. You know, people are facing difficulty recalling things, focusing on their day-to-day work. Could you help our viewers understand what a post-COVID brain fog really is and why does it happen?
Well, I think in some respects the best way to look at it is if you think about how we go into fight or flight mode and what shuts down and what keeps us going. And so it's that same kind of thing where rather than being in an immediate fight or flight mode, we've been in perpetual stress. And it is that kind of thing where we start to shut down in particular areas and we do feel foggy. And the one thing to recognize at this time is that this is normal, and I do very much agree that there are going to be lags. And in the same way that we had to get used to this dynamic and what this has done to our cognitive ability, to our mental health, we're going to have to transition out again into whatever the new normal is. But it's something that is really just, it's a product of stress, and it would be under any other normal circumstance. We're just seeing it at a larger scale and again, really amplified.
I think that also adds to the stress because nobody knows what the new normal is, and by the time you adjust to a situation, something else erupts. Dr. Holman, is the brain fog common in post-traumatic stress disorder too?
You can get that, absolutely. I think it depends, as the previous speaker said, the amount of stress that a person is experiencing is going to contribute to the degree to which a person experiences the brain fog. And the brain fog itself is itself a stressor. If you can imagine being stressed out, not being able to function and concentrate the way one might want to, that can cause tremendous amount of stress. And so, it is something that would be, yes, common that you would see with post-traumatic stress disorder, although the issue with COVID is that COVID is very unlike previous stressors and many stressors that lead to post-traumatic stress disorder because it is has acute punctuated stressors that we experience. For example, like if there's a death of a loved one in our network, And at the same time, as the previous speaker mentioned, it's ongoing. It has been a chronic, unfolding, protracted form of stress that has punctuated acute stressors, which makes it very different. And one of the things that I think has made it hard for people, and this is an area of research that I also study, is the distortion in our experience of time. We start to feel like we're not sure what day or time it is. We start to feel like maybe time's moving really slowly or moving really fast. And these distortions in time are also symptomatic of experiencing major trauma.
Dr. Lieberman, I understand that there are certain short-term and certain long-term mental health problems associated with the pandemic. So the question is, for how long after COVID can we expect these mental health issues to last, and what kind of time frame are we looking at? What problems, what symptoms?
We don't have good historical precedents to use to measure what the magnitude of the psychological traumatic effect is going to be and how long it will last. And that's because the whole discipline of disaster psychiatry, disaster mental health, has mainly occurred in the past 20, maximally 30 years, and it's usually studied events that were like earthquakes or hurricanes or tsunamis or even terrorist attacks. So these were traumatic events that were time limited, 1 day, 2 days, and also were geographically limited. This has been global for over a year. So the historical precedents are things like World War II, the Great Depression, the Spanish flu, and the data from those events is not that large. But if I were to speculate, I would say that we will see these effects enduring for years, meaning 5 to 10 years, and that for young people, children particularly, there will be a COVID generation, just like there was a generation that lived through the Great Depression. And the manifestations of that, we should be trying to determine and try to address preemptively before we wait for them to happen.
Sharon Blady, there's talk of a tsunami of psychiatric problems post the pandemic. Should we then say that sleeplessness, panic attacks, anger issues, lack of interest in work, anxiety, all of these are part of our new normal?
Well, I wouldn't say they're necessarily part of our new normal, but we, I think, have been put in a position where we definitely have to address and confront them in ways that maybe our current healthcare systems have not been addressing. And I do think it's something where we have been prompted to make investments that may have been delayed or deferred otherwise. And I think this is one of those things that we need to consider. And as the previous speaker mentioned, that, you know, we have to look at the fact that there are going to be different effects. They are going to affect individuals based on their experience. So in terms of their evolution in the long term, I do believe there are going to be multiple waves. It will impact the youth, and this is the opportunity for us to step in and make investments to try to minimize those things, but also to further longer term conversations, investments, and supports as they relate to mental health. We weren't given the opportunity to prepare for this, in terms of the scale, as much as there are, protocols in place for pandemics. This is at an unprecedented level. And as mentioned, we don't have the data. This is the time that we can start, based on what we do know, even if it is incomplete, start making those investments in prevention and care. So I think if there is a silver lining to draw from this horrific pandemic cloud on a mental health level, then it is the opportunity to make investments so that we can mitigate what those waves will be. But it's going to be interesting to watch how this all unfolds and to try to speculate where we can go with making those investments so that folks don't have to suffer any more than they already have as a result of the situation.
Indeed. Dr. Holman, I understand it's different for different people. Everyone has their own threshold, their own coping mechanism. But when do you suggest COVID patients get back to their day-to-day work post-infection? Popular culture says that deep diving into work when trying to cope with a problem helps sometimes, but does this apply to mental health problems too? Or is it recommended that COVID patients take time off after testing negative, if they can?
This is something that's quite varied. It would work, not everybody, there's no cookie cutter response for anybody. And I think it's really, really important to remember that. Every individual has their own life story, and their own life story will impact how they respond to COVID. So in general, I think that it would be wise for people to pay attention to the degree to which they're feeling stressed, to the degree to which they're feeling brain fog, and to be able to make decisions about whether they're ready to take on full-time work or not. For some people, full-time work or even part-time work helps them cope, helps them address the problem. But for others, there may be more factors in their lives that are making it harder for them to cope. And I think one of the things that's really important is for the societal response to this to be open to and able to support the needs of different people with different coping abilities.
Dr. Claypo, what do you think should be an employer's role here? A lot of young people fear that poor mental health will affect their career growth and job prospects. So what can employers do? What can teams do to ensure that they make an employee recovering from COVID feel at ease?
Well, as all the speakers have said, we're trying to figure this out as we go forward. And particularly in the case of employers, trying to figure out return to work versus hybrid working versus giving individuals time off. I do think one of the most important things is to understand that the same mental health issues that have been there, whether it's the anxiety, the stress, the depression, the post-traumatic stress disorder, what you're going to see, as the other speakers have said, is greater volume of that. And so what employers have to put into place is, number one, better preparation to manage mental health problems, which may affect things like absenteeism or partial absenteeism, as well as create communications among employees that acknowledge and validate the use of mental health resources. It's a big problem. People are hesitant. They feel that sometimes that their job is in jeopardy. So, as all the speakers have said, these are issues that we have been dealing with at varying levels, but now the impact is much greater, the volume is much greater.
Dr. Lieberman, then what is your advice to the millions of people around the world who are recovering from the pandemic? What should they do to ensure their mental well-being? And how do they, first of all, start by identifying that there is a problem?
Well, everybody is going through a period of stress that's not pleasant, and it's normal to if you talk to somebody and you say, are you depressed, are you anxious, are you worried, and they say no, then I would be worried about them because it's something that's just unprecedented and has been something we have had no control over. On the other hand, we know that there's going to be an aftermath. And the question is who's going to be affected by it and how bad is it going to be? And what will determine that is how what people's individual vulnerabilities are. So most people, I'll call them the worried well, are resilient enough so that they can use their common sense, follow good advice on public health, and get through this. If they lose their business, if they have no income, that's an added burden that has to be dealt with, but they'll get through. But individuals that have a pre-existing mental disorder, depression, anxiety, obsessive-compulsive disorder, substance abuse, they're at particular risk for having their symptoms exacerbated. Or individuals that have a pre-existing constitutional or genetic vulnerability, even if they haven't had a pre-existing condition, they may be vulnerable for this manifesting, and this can become severe and disabling. It can lead to self-medication with substances that can lead to addiction, or it can cause them to be self-harming and suicidal, or even domestic violence. Now, one last thing is that everybody's been saying we should prepare for this, and I particularly like the comments of Dr. Blatty, who's a policymaker in the Canadian government. Everybody talks about it, but nobody's doing anything. There's no preemptive effort to try and mitigate the psychological consequences, which are going to cause some proportion of the population to have a disabling and distressing medical condition. I've been trying to get the United States to be more focused on this without success. I'm curious as to whether in Canada anything's being done.
Sharon Blady, do you want to respond to that?
Yes, well, there have been things put in place here. So we have had everything from governments giving access to CBT courses online and free access to therapy, but it has varied over provincial governments. There have been things put in place by our federal government, including what were called economic response packages that involved biweekly and monthly payments, basically a stepping stone towards something like universal basic income. And I think that's the other part of this, is that while we are dealing with, a virus and then the pandemic implications of that on mental health, this is really about larger systemic investments. So it is about, we should be, if governments want to, facilitate recovery, it's about investing in people to ensure that they have a universal basic income, because financial stresses at a time like this are exacerbated. It's about investing in healthcare and social services, because again, those folks who are most vulnerable are even more vulnerable under this circumstance. So this has been an opportunity to see the cracks in the system and figure out what needs to be done. And I think this is, like I said, it's an opportunity that needs to be taken. And what we're seeing is that when governments make investments in their populations, that's when you see the greatest uptake and the greatest recovery in any circumstance. But the places that invested in things like universal basic income and other ways of ensuring that people did not encounter financial crisis had far better responses in both socioeconomically, but also in terms of political response and response to what governments do. This has been a time of insecurity where policymakers are in many respects making it up as they go along, trying to, follow the science, but the science is, half a step ahead of them at best. And so you're doing a lot of, for lack of a better way of putting it, policymakers are having to do educated guessing and hoping that they've got enough behind them to do these things properly.
Dr. Holman, this has to, I think, play out at various levels. I want to bring you in here because you've been a nursing professional. How do family and friends of COVID patients, what can they do? How can they help in their mental health recovery?
Well, I think what people can do to help their loved ones who have experienced COVID is to be very patient and very understanding and very compassionate in terms of just recognizing that there are challenges that the person is facing. One of the things that COVID has done is it has helped to undermine our sense of the future. And so helping a person rebuild the future by taking a small step at a time, toward a new future that they can look forward to is a really important part of coping. Second thing that's really important, and this is true for everybody, if your loved one experienced COVID and you're experiencing it vicariously through that, one of the things that's really important, and this is something that we've established in our research for decades, that the overdoing media exposure, seeing too much media about the pandemic and becoming engaged in what some people call doom scrolling is not good for your mental health. It's bad for your mental health. So if you have a loved one who has experienced COVID but is spending a lot of time scrolling through social media or engaging in media stuff about it, try to encourage them to not do too much of that, because that can actually have a very negative impact on your mental health. We've established that through several disasters, 9/11, Boston Marathon bombing, Orlando nightclub shooting. We see the media can actually, too much media exposure about a particularly negative event can have a very negative impact on your mental health.
And then sometimes in the media, they have these constructive conversations as well. Just because I represent the media, I have to say it. Dr. Claper, what is your advice to the patients and their families on how best to identify and then cope with this?
There's two factors. One, this truly is what we call a biopsychosocial approach or model, that there are biological factors that are contributing to this. There are psychological or psychiatric, but there are social as well, and they're all intertwined. So this is not necessarily someone developing a psychiatric disorder as a function of COVID directly, but it can be a function of downstream effects, loss of a job, loss of a loved one, difficulty in recovering, those things. And so understanding and being patient, not just with the mental health piece, but with the larger social issues that someone may be challenged with. The second thing is, and we know this from disaster mental health research, is individuals don't have to experience COVID directly, become infected, to develop these kinds of psychological, social, and psychiatric problems. The isolation, the doom scrolling, the lack of human interaction. Even if an individual hasn't developed COVID, they are still going to be at risk for very similar psychological issues.
Dr. Lieberman, the reason we are calling mental health a silent pandemic is because not many people are comfortable talking about stress or depression or anxiety. And those who talk about being disturbed are often branded crazy. So what's your message to various governments, to parents, to teachers, employers, everyone in our global audience? How can they destigmatize mental health?
Well, I think Dr. Blotty was speaking to that with saying this is an opportunity to address the cracks in our system. And there's few bigger cracks in the system than the neglect and underfunding of mental health care. So one of the silver linings of the pandemic is the fact that it's bringing the issue of mental health and mental illness out into the public and forcing us to look at it and make it okay to talk about it, because everybody's feeling bad because of what's happening. As to what impact that has in terms of, one, reducing stigma, or two, impelling governments or health systems to be more proactive in providing a better quality and a broader scope of mental health services, remains to be seen. The historical stigma and misunderstanding, discriminatory behaviors about mental illness have been very difficult to eliminate. In history, there have been many illnesses that have been associated with stigma and very, very negative perceptions. Leprosy, smallpox, cancer, tuberculosis, AIDS, HIV. But all of these have become sanitized in terms of science revealing what causes them, treatments being developed to manage them. And now it's okay. You can talk to Magic Johnson, who has AIDS, and know that he has AIDS, and you're not going to avoid him or think he's a leper. But mental illness has been much harder to eliminate the stigma of. And it may be because mental illness is something that affects not a part of your body so much as it is who you are as a person. But I'm hopeful that this will help in this gradual process of eliminating stigma. One other thing, Palki, to mention is that in terms of what people can do, there are many, many resources online at websites that have mental health first aid, educational information, or learning modules about how to help yourself manage, and then also have hotlines or phone numbers or websites to go to if you need to seek help from a mental health provider. And my advice to people is that when it comes to seeking help, if you think you need it, err on the side of caution. But in the interim, you can go online and there's a lot of information available.
Sharon Blady, I know a lot of your work is centered on destigmatizing mental health, so I want to end with you very quickly. What's your message to our global audience on how they can put an end to this taboo associated with conversations on mental health?
Well, by talking about it. First of all, it's okay to not be okay. And I am someone that lives with multiple mental health and neurodiversity diagnoses. And when I was the Minister of Health for the province of Manitoba, I went public about that, and I spoke about it, and I can tell that there were issues with folks in the building that maybe, within the legislature that didn't want me to go public, but I believed it was an opportunity to lead by example. So I think we need to be having more conversations. I'm not saying that everyone has to tell their story, but I think there are those of us who we can use our story and our experience to let people know, to model the behavior, and to start to demonstrate to folks that you can achieve great things while living with a variety of diagnoses, and that a certain amount of our own recovery comes from self-compassion and self-empathy, and then the understanding of others. So I would ask people to lead with compassion, empathy, and an open mind to those around us that do live with mental health issues, again, and that precede the pandemic. That's the best place that we're going to go forward, is with that mutual understanding and respect, and that's where stigma will come to an end.
Yes, and as you said, it begins with starting the conversation. We're going to end this session, but we believe and we hope that this will start some conversations. Ladies and gentlemen, thank you very much for taking time off for your busy schedules and joining us for our third and final session of this virtual summit. And with that, we come to the end of this very special summit. I hope that we've been able to deliver on our promises. I hope that we've been able to answer some FAQs. And most importantly, I hope that we've been able to start a conversation, a larger conversation around mental health. I would once again like to thank all our dialogue partners and also thank you for joining us on this digital summit. We'll see you soon. Till then, stay safe. Take care of your mental health.